Hey, aloha gang, Dr. Rosen here. Welcome to the OHC Community Facebook Live. It's supposed to be live. I tested it 10 minutes ago and it went live. I just went to do it right now and it didn't go live. For those of you who are friends with Zuckerberg, if you'd give him my phone number, tell him to give me a call so we could straighten this out. 4 weeks in a row now of it not working. Zuck, I know you can do better than that. Okay, so today we're going to talk about marketing. As a reminder, we're here 3 Tuesdays per month at 1:30 California time. And we're talking about how to thrive in a care versus care true optimal health model. You want to help your patients get healthy and stay healthy versus just treating their symptoms. That's what we talk about. I coach doctors just like you, chiropractors, naturopaths, osteopaths, acupuncturists, etc. And there's no question in my mind. There's more demand than ever. They want what you offer. You just need to know how to do it. We weren't taught this in school. I am positive we can get you waitlisted where there's more demand than supply. You can charge, healthy, fair fees, and get paid what you're worth. Just throwing it out there. Okay, so let's talk about foundations of wellness marketing. What I know to be true is we all want just the right number of new patients who get what we do, want what we offer. They value our care. They happily stay, pay, and refer for a lifetime. That's what we want. But the reality is, for so many of us, we are so frustrated because we have no idea how to accomplish that. We have no idea how to bring in the right kinds of new patients. We don't have enough new patients. They certainly don't get what we do, want what we offer. They're not, our perfect patients that, value us and happily stay, pay, and refer for a lifetime. So we need to get clear about the why behind the how and some of the how. So many, and again, we're talking optimal health marketing. When I'm coaching doctors at the beginning, they may have to be doing an ad for, shoulder pain, shockwave, which I'm a big fan of. Um, but those people are coming in for that, and then we have to help them understand this. Wouldn't it be nice if they already came in understanding this, right? -10 is near death, 0 is comfort. I feel good. This is what they think they can get when they come to see you. But we're talking about helping people resolve their issues, get healthy, stay healthy, have the best life possible. And I promise you, you can do that. There's absolutely no question you can. Okay, did I just get myself? Okay, so what is marketing? Think about it. What is marketing? Well, marketing is everything. It's everything people see, hear, smell, taste, think because of you. It's patient promotions, it's events or advertising, social media, how and what we communicate, what we have on the walls, the emails we send them, the texts we send them, the talks we do. There's everything is marketing. Okay. So the goal is to bring in the right number of qualified people into our office, the right number of qualified people. We don't want too many because it crashes our practice, but we don't want not enough. So we want to have a mathematical equation to make that happen. So how do we get the message out there? Okay, we're going to be talking about that. Now, where do new patients come from? Where do they come from? They come from excitement, they come from energy. The more excited you are, the more energetic you are, the more passionate you are, the more the word can get out. It's a headspace thing first. Then we got to know how to do it. So there's headspace and procedures, but we need you behind it. We need your whole team involved and excited and passionate. I talk about the coconut wireless in Hawaii or the cosmic AT&T. You know you're in a great mood. People come out of the woodwork. You're excited about a new technique you have or therapy. People come out of the woodwork. You're down. People call and cancel. So that's a big piece, the headspace and the procedure. So the first question I ask my doctors that I'm coaching is, are you ready for new patients? They always answer yes. More often than not, they're not ready. Have you been through the importance of certainty? Are you clear about who you are, what you do, why you do what you do, what you don't do, why you don't do other things? If you're not ready for new patients. You're just going to be a sieve. They'll come in and they'll leave. They won't stay, pay, and refer for a lifetime. So if you go to the guides section in here and go to certainty, go to master classes and go to certainty, listen to that. It'll really help you out. So we want to make sure that we're clear about that so we can clarify what it is we're bringing to the marketplace so we can then bring these people in. I don't want to bring these people in. I want to bring these people in. Okay. Have you taken your team through Get the Team to Grow the Practice? Do you know how to build a dream team? Do you have the right team? Now, if you're working by yourself, fantastic. If you do have a team, we got to make sure they're philosophically on board. So we have a whole program called Get the Team to Grow the Practice. We get them philosophically on board. We clarify, do you want to grow the practice? If they are bored, if they are stressed, oops, because there's more to do than I have time to do, or I don't have, the talent or the tools or any of that kind of stuff, and I'm stressed, then I can't grow the practice, right? You can't sustain growth and be stressed at the same time. We need to know that we have an operating system in place to set and achieve objectives. We've been going through this the last several master classes. We got to have the dream team. We need to know how to hire, put the right people in the right positions, behaviorally speaking, that we have the right bonuses in place, performance appraisal systems in place. We know how to train and regularly train. We know how to do meetings, et cetera, et cetera, et cetera. If you go to the master classes under guides, that's what we've been doing the last several weeks. We need to understand this basic concept that we're going to make space, reorganize, and make space and fill it, and then reorganize and make space and fill it. And you can grow as big as you want to get. But right now, let's say you're seeing 10 people a day. Could you handle 100 people a day? No, you couldn't. You don't have the system in place. So we have to be able to reorganize and make space, fill that space, reorganize, make space, fill that space. And we can grow at a 45-degree angle. Okay. Again, I talked about a lot of this stuff in the last modules that we've gone through. Um, so we need to we need to know how many people we need. So you want to do it mathematically. If you do 10 patient visits a day, 4 days a week, that's 40 people a day. If you have a PVA or retention of 40, you only need one new patient a week to sustain 40 people a week. That's it. But if you have a retention of 20, you need two new patients a week to sustain that. So you got to do the math. Okay. Now, how do we market? Marketing comes down to three things. Number one, get very clear about who your niche or niche market is or are. You can have as many niche markets as you want, but we only market to one of them at a time, right? So how do I figure out who my niche market is? Well, I get really clear about what is my passion. What do I love doing? I love working on shoulders. I love helping people, get pregnant. I love helping the brain function better and help people with ADD or depression or anxiety. Who do you love to work with? Do you have the skill set? If not, get the skill set. And then do they need it? So I love working with downhill skiers, right? But I was living in Maui, not a lot of downhill skiers. So is there a need for that in my area? I just started working with a lady. She's I think a nurse, and she deals with death and dying. She deals with having people age gracefully and then the dying process. Is there a need for that? Yes, there is. Is she skilled at that? Yes, she's really skilled. She worked in hospice, et cetera, et cetera, et cetera. Okay. So what is my niche or niche market? Again, I can have as many as I want, but I'm only going to market to one of them at a time. What is the sticky message that would interest that market? So let's say you were working with athletes. What are three things that would interest an athlete? Personal bests, Prevent injuries, recover faster when you injure yourself. That would interest them. Pregnant women. How do I get pregnant? How do I stay pregnant? How do I have a good pregnancy with not a lot of pain? How do I have a good delivery? And then how do I get back in shape? That would interest them. You can see that I'm not going to do the same marketing campaign to both of them. They're going to be different. I'm not going to do the same talk to them, the same social media to them, whatever it is, right? Okay. Now, some questions you might want to answer to clarify your sticky message. What are their biggest fears about their health? What are the unanswered questions do they have about their health? What are they unhappy with regarding their current healthcare approach? You want to come up with solutions to these challenges, and that's going to help you clarify what the sticky message is that would attract those people. Okay, so we know who they are. We know what the sticky message is that we're going to get to them. Now we got to figure out how are we going to get the message to them. Well, there's four categories. One is internal. What am I doing inside of my office? External. What am I doing outside of my office? Reactivations and social media. Those are the four ways to get the message out. So internal, I can do a series of talks. I can ask for referrals. I can do promotions. I can do events. Lots of things I can do inside of the practice. Externally, I can do radio, I could do TV. Most don't, but if you have a very specific niche market like disc or neuropathy, that works really, really well. I can do outside talks, I can do outside screenings. Then I can do social media. Now, obviously, that's outside of the practice, but I separate it for this discussion, and that's the wild, wild west. There's a ton of stuff there. Mostly your social media advertising like Google pay-per-click or Facebook is going to be symptom-based, and it's going to be a race to the bottom. It's going to be the cheapest, $19.99. Come in and get, an adjustment with X-rays and blah blah blah. But if you need to fill the funnel, that can work. That can be a good thing to do. Eventually, I like to get my doctors off of that and really internal referrals, healthcare classes, that kind of thing. That's what keeps us full. And imagine they came to a talk and you were before they even saw you for visit one. You're really clear. This is what I do and this is not what I do, right? I'm a brain-based practitioner. I help people with these kinds of problems. Here's some case studies of people we worked with. My main focus is helping people get healthy and stay healthy, resolving their problems. Here's how we know the brain is functioning better. These tests, et cetera, et cetera. Imagine if you did that and you showed them, here are care plans. This is what it looks like. Small, medium, and large. This is how much they cost. Could you imagine if they already knew that before they came to see you for visit one? Your sign up rate is about 100% because they already know it, right? They don't come in, this wasn't the right place for them, and that's okay. Um, and then there's reactivations, and reactivations, of course, is internal also. I just separated, and we've got a whole lot of people out there who some of them hate our guts and would never come back. Some of them would love to come back. They just need a nudge. So those are the four ways in which I'm going to do it. Okay, a basic a basic thought in marketing is that marketing to everyone is like marketing to no one. Standing on a roof yelling chiropractic works, naturopathy works is like marketing to no one. The smaller the niche market, the bigger the response. So if you're just saying get your back cracked, well, that's what you're going to get is people that want to get their back cracked. Most of the people I work with want to help people get healthy and stay healthy. It's really the wrong approach. I could stand at a bar and stand up on the bar and just say, hey, chiropractic works. Again, maybe not the best approach. But the more specific the marketing, the better response I'll get. If I am wanting to work with left-handed red-headed golfers, and there's a magazine called Left-Handed Red-Headed Golfers, or a golf club or a Facebook club called Left-Handed Red-Headed Golfers, getting my message out to them could work really, really well. People who have anxiety, people who have depression, people who have ADD, brain-based conversation, people who have, athletes and joint problems, etc. That's how I'm going to get the message out to them. Think about this. Who gets paid more? You've got a general practitioner, medical doctor, and you have a medical doctor who is a right hand, right thumb surgeon. They only do surgery on the right thumb. That's it. Who has a wait list? Who makes more money? Right? That's what I want you to be. I want you to be a specialist. Now, remember, when they come in, you can also see their friends and family. Chiropractors tell me all the time, if they're breathing, they're still breathing and they have a spine, I can help. And that's true. I understand it. It's just a horrible marketing approach. So market for the type of person or the symptom, the thing you can help with, and then you can see their entire friend, all their friends and all their family. Now, I coach doctors who don't do that. I coach doctors that this is all I do. I do disc and neuropathy. That's it. If they have friends and family, I refer them somewhere else unless they have disc and neuropathy. Again, there's lots of ways to make this work. So, um, you want to design your campaign specifically. Again, it's going to be a different campaign to pregnant women than it is to athletes. Completely different campaigns unless they're pregnant women athletes, and then that would be a different campaign. Again, you want it to be mathematical versus emotional. I don't want to do reactive marketing. Oh, shoot, it's time I need, right? I want to do proactive marketing. I want to have a marketing calendar. Now, in the club, I'm going to go into detail about how to come up with a 13-month perpetual marketing calendar. We're going to show you how to come up with that, to stick to the process, and then and I'll be going into detail about it in the club. Now, if you want to jump into the club, I'll give you a free month. It's Thursday at 11 o'clock California time. We do 3 Thursdays a month. It is Zoom, so we're having a conversation, and I'm answering any and all questions, helping you really apply this. And it's the best of series. We're going way more detail than we do right here. Just put club below, and I'll go ahead and get you in there. So in general, we're going to come up with a graph, and it's going to go across the top, say internal. Let me see, you're looking at me this way. So internal, external reactivations and social media. Then down this side, it's going to say daily, weekly, bi-monthly, monthly, quarterly, biannually, and annually. And I'm going to fill these in. I want to see a balanced approach. And then we're going to come up with how to monitor our marketing events. So you need to monitor your events. I don't want to go by emotions. Here, and every month we're going to put down, this is the event that I did. I did an inside talk, I did an outside talk, I did a screening, I did social media, et cetera, et cetera, et cetera. This is how many people I expected. This is how many people signed up from that event to come in. This is how many people actually made it in. This is how many people that made it in actually signed up for care. How much time, money did I spend on this? And then what was my return on my investment? So you can see that I want to make this mathematical. I don't want to make this emotional. We're then going to be diving deep into this formula: make space and fill it, reorganize, make space and fill it. So if you recognize that there's room for growth here for you, please go ahead and put club below. You can join there. If you're serious about growing your practice, contact me. Let's set up a time we can talk and I can help you grow. It's the beginning of 2026 right now. Do you want it to be better than 2025? Do something different. I can help you. You want to help people get healthy and stay healthy? I can get you waitlisted. I can. My goal is for you to be fully waitlisted, doing no marketing at all other than internal marketing. That's my goal for you. So if you know people you think might find value in this, please let them know about this Facebook community. And if you'd like to jump into the club, go ahead and put club below. As always, much love and aloha. Bye, gang.